Hi everyone! Today I'm going to talk with you about my behavior change project. The goal of this project was to determine if the usage of functional communication training without extinction with reinforcement of appropriate behaviors would increase the number of spontaneous breaks requested in a 7-year-old named Henry with Down syndrome in order to appropriately escape a task or demand that was given in the resource room setting. The operational definition for my project was an appropriate spontaneous request for a break was defined as Henry verbally saying, "I need a break," or physically pointing to his break picture or walking over to his break spot within 2 minutes of the verbal or physical request. This project was implemented by the student's special education teacher, general education teacher, behavior therapist, and 5 paraprofessionals. The independent variable for this project was requests for spontaneous breaks. The dependent variable was functional communication training with reinforcement. I used an A-B-A-B design. I collected IOA data for the baseline, intervention, and intervention. For the first baseline, the IOA data calculated at 67%. For the first intervention, 100%, second baseline, 83%, second intervention, 83%. Considerable training occurred after the initial baseline due to the low IOA percentage in 2 one-hour practice sessions. Treatment fidelity was also calculated via a treatment fidelity checklist. Treatment fidelity for baseline 1 was 50%. Again, considerable training occurred after this due to the low percentage. Treatment fidelity for intervention 1 was 100%. Treatment fidelity for baseline 2 was 90%, and treatment fidelity for intervention 2 was 100%. The results determined that baseline 1, the student requested a spontaneous break 15% of the time. Intervention 1, he requested a spontaneous break 75% of the time. Baseline 2, 10% of the time. Intervention 2, 90% of the time. These results concluded that functional communication training procedures plus reinforcement increased spontaneous requests for breaks. There were many limitations in my project, in that typically functional communication training procedures are paired with extinction strategies as well. But due to the nature of Henry's unsafe behavior, such as elopement and running away, exiting the building, running across the parking lot, this could not be addressed in this graduate class. In addition, this project only occurred in one setting, which was the resource room. There was a low IOA and treatment fidelity data for the first baseline, and we had a lice outbreak in the first intervention stage, and therefore the student's break spot changed a bit in that we had to remove the pillows due to lice, and we replaced the pillows with a chair, but that could have an impact on the student's willingness or ability to access the break spot. In addition, baseline data was not steady and more time was needed in order to create for a more steady baseline. In the future, we should address the extinction in that trying to eliminate the student running away from the building, better training for staff members, and generalization across different settings such as the student's general education classroom. Thank you for listening. I look forward to hearing about all of your projects.